Every day, more than 115 Americans die of an opioid overdose. In 2017, the opioid epidemic was declared a public health emergency, and America's opioid crisis is now the biggest drug problem in U.S. history.
We've never, ever seen the death rates that we're having today.
The opioid epidemic has been a growing problem since the late 1990s, when pharmaceutical companies assured health officials that patients would not become addicted to opioid pain relievers. This claim would be a catalyst for overprescription and widespread misuse of legal opioids like oxycodone. It would also lead to a spike in illegal opioid use, such as heroin and fentanyl. Fast forward to now, we're seeing the devastating results of opioid addiction.
They found my son in there on the toilet, slumped over with a needle in his arm, dead.
According to the U.S. Health Department, more than 11.5 million Americans are misusing prescription opioids. 2.1 million of those Americans have opioid use disorder. According to the Florida Health Department, last year, 4 of 5 new heroin users were first painkiller abusers. Fentanyl has also become a major player in the opioid epidemic and is 50 times more potent than heroin. While Florida lawmakers continue to introduce legislation to fight the opioid epidemic, Florida's problem isn't slowing down. Our local recovery center, Epic, saw a 20% increase in detox admission over the past 2 years and had 108 people on a waiting list for treatment. Last year, St. Johns County Fire Rescue treated 180 overdose patients with life-saving Narcan.
It's now the #1 cause of accidental death in this country.
In St. Johns County, 63 babies were born addicted to opioids in 2016, and in 2017, our county lost 35 lives to opioid overdoses. Today, a panel of experts are going to address this problem and propose solutions to this very real and devastating epidemic. Together, we can help save lives in St. Johns County.